Go for it. Hello, my name is Adrian Urias, representing Automedx today. I want to present our recently designed ventilator that we worked with DARPA to develop initially for Special Forces medics all the way through frontline battlefield medics. We have recently been working with Dr. Callahan to be able to produce this device and take it to show other countries, as well as basically promote it within the military market, as well as trying to get into the civilian market here in the U.S. The purpose of this particular ventilator is to get the smallest compressor-driven ventilator out in the market today. Unlike other ventilators, this ventilator runs off of ambient air. We are only using ambient air. We can use supplemental oxygen if necessary to be able to get to an FiO2 of 100%. But if you don't have pressurized gas, it's unnecessary for the device to be able to run properly. The purpose of this particular device is to basically make it simple for anyone to be able to get the device started in a safe manner. So as you can see from this particular ventilator, when a user first comes up to set this up with a patient, all they have to do is select the patient's height. The purpose of that is that when you choose the patient's height, you can then basically calculate the ideal body weight of the patient. This is something typically the user will have to calculate themselves and then take that ideal body weight and then turn that into another calculation of what is the appropriate tidal volume. This device will do all that for you. So all you have to do is select the patient's height, press confirm, and that will deliver a safe, appropriate tidal volume, respiratory rate, and peak inspiratory pressure limit for that particular patient. So that way you can start ventilating immediately and safely until someone with more expertise and training can come over and override the device and set other settings to change the tidal volume, respiratory rate, peak inspiratory pressure, or PEEP if necessary. As I mentioned, this is very small. It's 2.5 pounds. It's meant to be for frontline medics, but it's all the way through transport, as well as in-hospital use as a backup or if necessary for anything else. This particular device runs off a lithium battery that can be replaced if necessary, but right now it's like this particular device runs 10 hours off a single charge. We can plug the device in if you do have wall power, and so you can run and charge simultaneously. So if you are running out of battery, you can plug it in and it'll start charging itself at the same time, and you will not be without power. So I'm going to do a quick run through of what the device is capable of doing for a particular patient. When you first turn the device on, you'll see a dashboard of lights down here. Those are all the alarms that can come up. They're purposely blanked out so that normally it's not distracting someone, and especially someone minimally trained, they're not going to be distracted by all these other things going on. But if an alarm does happen to come up, only that alarm will show up to tell them specifically what they need to look at to solve the problem. So right now the unit is prompting the user to select the patient's height. So for our purpose, we're going to hook up the patient breathing circuit. There are a few ports in the back. You have an air intake port. This is where ambient air is pulled into the ventilator. And you have 3 ports over here. This is the patient circuit tubing. This is what the air is going to the patient. You have the pressure line that is monitoring the patient airway near the patient airway to make sure that you are delivering an adequate amount of pressure to the patient, as well as making sure you're not delivering too much pressure. And then you have a control line that controls the exhalation valve on the patient breathing circuit. So that'll control when the patient is allowed to exhale, as well as being able to dump the air if too much pressure is being kept within the circuit, or to maintain PEEP if necessary. So we'll hook this up first. So we have the pressure line and the control line. We also have, if the patient has to breathe on their own during an exhale, they can pull air in through here, independent of the ventilator delivery. So going back to the initial, we'll select a height of the patient. When we select a height, the device will now display the respiratory rate, tidal volume, peak inspiratory pressure, and the PEEP, the safe settings for this particular patient. It'll then prompt the user to confirm this setting. Once they confirm, it'll start delivering. So right now we're hitting a peak pressure. We're hitting the pressure in the lung. It's a little too high. So we'll adjust that.
Is there a fake lung?
This is a fake lung here. So now that the pressure has been relieved in the patient breathing circuit, is now delivering. That alarm that was previously blinking has gone solid. This happens if someone is not looking at the ventilator when the alarm happens. If a patient coughs, air pressure is reached, it'll hit that alarm, but once it's cleared, it'll turn solid, and after 30 seconds, that alarm will disappear. And so that way the user doesn't have to be bothered with it, it'll clear itself. And so right now, it'll deliver as necessary. If the wrong height was selected for any reason, they can select a different height and just confirm it, and it'll reset it. However, if a physician comes in that needs to override the device, they can change the ventilator settings by changing the tidal volume, they can change the peak inspiratory pressure, or even put PEEP in the unit. Once they change all those, they confirm it, and now it's overridden for these particular parameters for that patient, whatever they need. It's also important to note in terms of where this device can be used. I mentioned earlier the point of injury. So the device is very small, lightweight to be carried. It's also very rugged. It can be dropped. There's shock, vibe. We've been going through all that testing for military. It's also meant for transport. As I mentioned, it has a 10-hour battery life, but it can be wall-powered as well. We are expected to get air transport similar to our previous ventilator, the SAVE. It's also important to note that this can be used as a hospital backup, and so it's safe from an EMI perspective, and so any other wireless devices it's not going to interfere with or be interfered by. So this can be used, again, from the point of injury all the way through the hospital if necessary. In terms of the type of patients it can see, and it can be anywhere from respiratory failure all the way to influenza and ARDS-like symptoms. Especially what dealing with MERS. And so if that is a situation, you can easily adjust the peak inspiratory pressure to be able to adjust for those higher airway pressures that those patients are seeing, as well as increase PEEP if necessary to be able to ventilate those patients adequately. Good.
Maybe you could mention just the decontamination capability of it.
And so right now, it's like in terms of decontamination, this is a single-use patient breathing circuit. So once it's done with that particular patient, this will be cleared, and you can get rid of it and replace it with another circuit. All the exhalation is coming out of the valve on the outside, so it's not going back into the ventilator. In terms of just normal contamination, it can just be wiped down with a soft down cloth. So there's nothing that's getting back into the unit, so this can be reused for another patient.
Great, thanks so much.